Thank you very much. A very sensible, if I may add the pun here, conclusion to our presentations. I would now like to invite our speakers from this session to switch on their videos, unmute themselves, so we can start our discussion session for the day, for which we have 15 minutes. Whilst I've been busy typing questions in the chat box, I would like to first invite participants and see if they have questions for any of our speakers. And we've had such a wonderful range of topics covered in this session, so I'm sure we'll have lots of questions. So any questions from the participants? You could either type in the chat box or you could raise your hand, virtual hand, whichever is easy for you. Murtaza, yes, please.
Yeah, I do not have a question per se, but I would like to congratulate Dr. Sallis for an amazing presentation, and the visuals which you used in your presentation was so engaging that I actually lost track of time, and the entire setup was so convincing. Your idea, you were able to convey the message so clearly. I would really amazing. And if you do hold a masterclass in presentation in future, please do let me know. I would like to join and learn from you. Although having said this, I did have a query in one of your graphs where you had two charts, one talking about transmittable disease and one non-communicable disease, and you had some parameters, environmental parameters, building parameters, to state how those factors were impacted. So it was a bit confusing at some point when you meant favorable, as in that did it lead to favoring the transmission, or favorable in the sense that it cut the transmission?
No, that's a very important distinction to make, and thank you so much for your kind comments. It means favorable for health. That's what it meant. So better health outcomes. So less infection transmission.
Thank you. Thank you.
Thank you. I'm just checking to see if there are other raised hands. I mean, if participants need time to think, I think I have typed a couple of questions in the chat box. I'm indulging myself as a chair of this session, and I'm going to start with Carlos. Carlos, I mean, what was very much in my mind when you were presenting is the fact that in Scotland, children are going back to schools, and we are seeing a rise in COVID cases. It's likely the same is going to happen in other parts of UK. I was wondering if your research kind of would help to, well, when I say address the challenge, I mean, I'm expecting you to solve this problem, but whether your research findings could feed or provide evidence towards kind of schools and what could be done in schools.
Yeah, thank you. Well, basically, we are actually involved at the moment collecting data from a couple of schools in Essex. It's something that started more from the thermal comfort, and because of COVID, it's basically pretty much you hit the nail in the head. It's basically a big problem at the moment, thinking about how much ventilation do we need, how do we maintain that. I mean, the other aspect is that we cannot get to these buildings and expect that we can retrofit everything into mechanical ventilation. So there is a lot of aspects to apply this kind of approach. I think for me the most important thing is that we don't need to have all the investment and high technology to do things. A lot can be done just in a simple way, and even analyzed in a pretty simple way to get an answer. And I think we're going to see more and more happening with the schools and university buildings as well.
Yes, I'm trying to ignore university buildings because we still got 3 or 4 weeks for that. I think the schools challenge is much more imminent. But I'm really delighted to see that you are engaging with schools. And I read there's now a government policy on kind of monitors for air quality in schools. So we'll see how that all shapes out. But I'm really pleased you're engaging with schools. Now I have a question for James, and in your presentation, you highlighted the need for physical activity, which I totally agree with, and there are studies now around the world showing that physical activity is very vital. What we are finding in London is that there are deprived communities who, some of them may not have access to public spaces. So are you kind of finding those inequities, for example, in cities in the US as well?
Absolutely, yes. But it's not universal in the US. We've actually looked into the quality of parks and the distribution of parks as an example, and found differences by city, and it depends on their policies. So we found that some cities have a history of racism that shows up in inequitable distribution of parks and quality of parks. Other cities, I'll mention Seattle, has a policy about generally providing equitable services to all citizens. And in Seattle, we found in several cases better quality parks in the lower income areas. So I think this is an encouraging finding that inequity is not inevitable. It depends on decisions that can be made and then changed. So I think this is something to empower public health and community organizations to advocate for more equitable policies in their local area.
No, it's wonderful that you do have findings, at least from some cities, that those living in deprived areas do have access to public spaces, because it's all well and good to tell people to exercise, but if they do not have access to spaces, then it does not really work. So it's good to see that some cities are implementing more inclusive policies. Now, Dr. KQ, I have a question for you. I was kind of taken aback by the gap we have in retrofitting buildings. You had this massive kind of gap that you presented to us. I was wondering, in your study with homeowners, are you kind of considering or thinking about kind of financial models, or how could this be jointly financed with homeowners? Any insights that you could share, I would be grateful for those.
Do you mean the financial models, how to calculate the heat?
Well, conceptually, I mean, how is the government going to fund this retrofitting? Is it going to be funded by the government? Is it in partnership with private sector? Just wondering if you had thoughts on how it is going to be possible to tackle and finance this big challenge.
Okay, so this models is for is for decision makings for the homeowner to select optimal retrofit combinations, and if they could find the fundings from government or the local committees, or they can also pay by themselves for the building retrofit. And once they have set for the limit or the scale that it could be acceptable for the fundings, they can use this model to do simulate and to say in their acceptable range what kind of combinations is suitable for them.
And do you think there's going to be a difference? Because if, say, I'm renting, am I going to be less inclined to pay for retrofitting versus someone who owns the property, for example? So are there going to be those type of barriers for retrofitting?
Yeah, it's a good question for me.
No, it's just maybe it could be a future research question. I mean, you don't have to answer it right now. It's just I'm just curious as to if you were to take a couple of cities and think about characteristics of those people who would invest in retrofitting versus those who would be looking at government support. It could be an interesting kind of future research topic.
Yes, and we can also use this model to for example, for different cities or communities, we can have a service about or just individual homes. We can they can set for the objectives for what they would like and see how the fundings would be, and we can have to do some research on recommendation for policies for government for how they could help them to do the building retrofits.
Thank you. And Julianne, I had a question. I mean, you presented very nicely scenarios and models where you're looking at comfort based on velocity and temperatures. I saw in one slide you briefly mentioned humidity. Was humidity something that you factored into your model?
Okay, thank you for your question. Yeah, about humidity, I did not apply humidity in the ANSYS software. So I used ANSYS to model these contours. I've mainly put most of my attention on the velocity and the temperature values. So maybe in the future work, I could consider humidity in the model. But for now, from what I know, in the UAE, the humidity can reach up to 90%, which high humidity can lead to discomfort to some participants or to some people in the residency. So yeah, hopefully in the future work, I can consider humidity in my model. Thank you.
Yeah, 90% humidity, if you combine it with temperature in the mid-30s, that's very uncomfortable. So I can imagine the level of discomfort. I mean, I grew up in western part of India where our summers would go up to 40 degrees, but they would be dry. And then you get the rainy season where the temperatures would go down to 30, but the humidity would be between 90 and 100%. And that was tougher than the 40-degree summers. So I can absolutely imagine the levels of discomfort. I see Murtaza, you've raised your hand.
Yes, thank you. I do have a question for Ms. Julianne. When I missed the thermal settings for the model. So you mentioned you had a specific boundary conditions. So did you also, as Dr. Priti was mentioning about humidity, did you consider radiation in your model? Was that part of the calculation? So, I mean, how was the temperature differences brought about specifically? Was it only because of wind flow, or you had certain boundary conditions or thermal walls enabled in your model to account for that?
Okay, thank you for that question. I did mention the boundary conditions prior in my presentation. So I did only consider like temperature, velocity. I have also placed like the near wall treatment, the wall roughness, wall temperature, and the gravity, or even I've also made sure that there is symmetry for the top and the side surface. So these are the values that I have considered. I did not consider radiation as you have asked. I hope that answers your question.
Thank you. Yeah, maybe that could be a future direction as well, because
yes. Thank you for the input.
And I see a comment in the chat box, unless Murtaza you have, or your hand's gone down. I see a comment in the chat box from Seyu. I'm going to put you on the spot because I know you for a long time now. Would you like to kind of share your comment with us? Seyu, are you still there? No? Or if you're feeling shy, that's okay. Seyu's just posted a comment. It's more of a comment about her work in flood risk management, where they're seeing that if people rent or own a property, it makes a difference in implementing flood resilience measures. So perhaps there's a conversation to be had between Dr. KQ and Seyu, and maybe they can come up with a joint research proposal. And Carlos, you've suggested kind of a future work linked to the Universal Thermal Climate Index. So Carlos, thank you very much for your suggestion. Before we close the discussion, any questions from participants? Any questions from the speakers to each other? I see a raised hand. Please go ahead.
Yeah, hello. I have a question for Carlos. Carlos is Hua from Nottingham Trent University. Nice to meet you again. We initially know the passive house standard is designed for pretty much new build. So what do you think about the challenge use a passive house standard for retrofitting project? And is any quantified measurement changed, baseline changed for especially the retrofitting project?
Hi, thank you for the question. Well, actually, we can actually apply the standard, and that's why we call it EnerFit, and the potential is there. And to be honest, I think the idea of actually trying to drive the fabric and the air tightness to passive house levels is actually much more important than maybe spending. Sometimes we are doing retrofitting and spending on different aspects. So it gives quite a lot of potential. I mean, the two properties I show in the presentation, they're actually in listed areas. So they're not easy to actually work with. So for example, they have secondary glazing, internal insulation on the front facade. So they weren't the easiest projects to retrofit, but they managed to do it very well. And so I think from the work about optimization as well, there is maybe an idea perhaps to actually show if we invest deeper into reaching those levels of passive house. I mean, to be honest, it doesn't need to be passive house, but at least the U values and the air tightness should be in that level. I think that's what we are all hoping for the government to be pushing more with the building regulations. We are pretty far off. But I mean, if somebody asks, I think working on the fabric and the air tightness will be something like around £40,000. They're probably the best £40,000 you're gonna spend in your house.
Thank you. Yeah, I have another question for both Julian and Carl. So you designed a safety model for simulation, and Kai designed a mathematical model. But the final output for both of you want to give us a unified solution, or you will consider the further research. You say most of the building project is case by case, and the occupancy opinion and their feedback will be quite different. Can you make your model more resilient in terms of different occupancy type and in terms of timeline, also in terms of the climate change different scenarios?
Sorry, was that a question?
So I mean, for your final output of your research, can this model, can this simulation change in terms of different scenarios, or you finally just give us a unified solution?
Okay, yeah, like from what I understand, you're saying like, can I change the situation or the climate and input different values, you mean?
Yes. And also from the end user point of view, they maybe have a different thinking, different requirement. So can this model be flexible, basically?
Yes, sort of. Like as long as you know how to input the values in ANSYS, you can try giving different scenarios on the model itself. Like as long as you have the model and you know how to input the settings or the scenarios that you're saying, it can then it can produce the results that you'd want or that you'd try to predict. So yes, thank you for that question.
Thank you.
Thank you very much. I think we need to draw the discussion session to a close, but before we close session 3, I wanted to thank all our speakers for such engaging and diverse presentations, and for also wonderful responses to your question and answers. So thank you very much. And now I would like to hand back over to, I don't know who I'm handing back over to, whether it's Lane.
Me. Conrad.
Okay, so I'm handing back over to you into your capable hands. Thank you.
All right. Thank you, Dr. Priti. Thank you, Dr. Priti and Murtaza for sharing the session. And thank you for all the presenters. You gave a lot of wonderful insights, and our apologies if we have a lot of technical difficulties. Don't forget, we posted this one. You should vote. Who is your favorite speaker for session 3? So please submit your vote before we exit. We end our workshop for today. And so tomorrow for the UK participants, there's going to be a half-day session tomorrow, and it's going to start at 8 a.m., 8 in the morning, and it will last until 11:30. Okay, so this just go again, and for day 2, for I think China, they're going to start earlier. Also 8 a.m., but that's in China. So for the for UK colleagues, you can join again tomorrow. I'll be there again. Right? Okay, so that's it. Thank you for the day. I enjoyed watching all of you, and I hope you had a good time. Please keep in touch, and hope to see you tomorrow. Goodbye. Bye-bye. Good night.